ever seen a snake bite cases in front of you, and what did you do in that situation? As a healthcare provider, you can't stand quiet. So but before doing any help, you should be aware what to do, what not to do in that situation. So in today's video we are going to deal all with that. So let's start the video. When you see a snake bite patient in front of you, first of all, reassurance being ignored most of the time, because we think that reassurance is just a waste of time, but this is the most important step. Because why? Because reassurance is given to the patient anxiety level is going to decrease. Otherwise the patient anxiety level is increased and the heart rate is also going to increase, and because of that the patient land up into death. This is the most common cause of mortality in these type of patient. So tell the patient, do not panic, and give reassurance to the patient. Now second is clean with water. Now third step is immobilize that wound by using a splint may be the rod or maybe the wood, or by using a crepe bandage. We have just seen this diagram. By using a crepe bandage, just wrap around by using the crepe bandage and the splint, the affected part is being wrapped. Okay, and the fourth thing is that apply the tourniquet, but do not apply the tourniquet. It always should be one finger loose. It should not be so much tight that it occludes your arterial supply. When is arterial supply is obstructed, then it causes the edema in the distal part. So we just want the superficial lymphatics to be obstructed, not the arterial one. So we are always make it one finger loose. Now some of the old techniques that are doing more harm than the benefits, like first is cutting off wound. We should not cut the wound. Second is squeezing the wound. Don't squeeze the wound. Third is sucking the poison out of the wound. So it should also not be done. Now there is a scenario. This is a quiz. What if the patient comes to the hospital and a tourniquet is tightly tied? Now what you are going to deal in that situation in a snake bite patient? Just pause this video for a second, and whenever you see this type of cases and the tourniquet is tied, what you will do in that situation? There is normal BP cuff available in your ward or in your house. What you do, you have to, like, this is a fang marks. Okay, now a tourniquet is tied above the fang marks. Now you have to apply a BP cuff that is inflated above the systolic blood pressure, right? These are the fang marks. Imagine this is the fang marks and you have applied the tourniquet. It should not be tight, just keep in mind, it should not be so much tight. Now this is the tourniquet and you apply a BP cuff. It should be inflated above the systolic blood pressure. Now okay, now why we are doing all these things? Because we don't want the suddenly when we open this tourniquet, the suddenly that gush of poison which is accumulated here, it just enter into the circulation, right? So we remove this. Okay, now we remove the tourniquet and this is already inflated. Now what we do, we just deflate it slowly, so that when we deflate it slowly, then it slowly the poison or the gush of poison is not entered into circulation. The slowly that poison is entering into circulation and body get the chance to cope up with that. Examination. In local examination, we see the fang marks. In cobra or the neurotoxic patient, you will see the fang marks like this, and now and that is venomous. And in the non-venomous snakes, you will see the marks like this, right? You will see, just see in this diagram, this is the venomous and this is the non-venomous. In venomous you will see a dark two dots in the center, and there is a fainted line on the sides. But in non-venomous snake you will see all the fainted lines. There is no dark line on the So you just see in this image. Now one exception is there. Crate doesn't leave any fang marks, like, because it's a venomous snake, but, and I already told that the venomous snake leaves these two dark dots, but in crate it has a very thin fang mark, so it doesn't leave. Okay, when the patient shifted to the hospital, there first thing is ABC approach. We have to check the airway, breathing, circulation, check the blood pressure, temperature, all the vital parameters we have to check. Now, second step is single breath count. We have to tell the patient to take a deep breath and start counting till 30. Like if I'm taking the deep breath and I'm starting from 1 2 3 4 till 30, if I'm able to make it till 30, then my breathing pattern is good. Now if it is deteriorating, then you have to shift the patient to the monitor, to the ventilator. You have to closely monitor the patient. Now third is take the brief history of the patient about the appearance of the snake. If the patient had seen, or patient attendant had seen, so take the brief. So I just want to tell you about some points about neurotoxic and hemotoxic. Now neurotoxic snakes are those snakes like cobra and crate. They are very poisonous and they affect our nervous system. So first is like ptosis. Ptosis means drooping of eyelids, the breathing pattern, respiratory discomfort is there, and the patient having dysphagia. So all these symptoms you will see in these type of patient. Now there are some hemotoxic snakes. Hemotoxic snakes are Russell's viper, saw-scaled viper, and the pit viper. The Now the Russell's viper causes renal failure and oliguria. There's hyperkalemia and the dialysis. In hemotoxic patient, there's coagulopathy. The bleeding from that site is bleeding from the bite site is there, and the patient is having hematuria, epistaxis, right? So how, if you are sitting in a periphery, how you are going to distinguish it neurotoxic or hemotoxic? What you have to do in that situation, when you're sitting in a periphery and you have to distinguish the neurotoxic, is it neurotoxic or hemotoxic? You have to take the sample of the patient and keep it undisturbed for 20 minutes. If that sample, the blood sample, is coagulate, then it is the neurotoxic, and if it is not coagulate after 20 minutes also, then it is some coagulopathy is there, like the patient is having hemotoxic, right? Now we are treating the patient like hemotoxic, like to give FFP blood products we have to give. But if there is neurotoxic snake, if bitten by the neurotoxic snake, then we are giving injection atropine and injection neostigmine, okay, just to relax the. So for the treatment, we are giving polyvalent anti-snake venom, and this should be diluted. 50 ml of anti-snake venom is diluted in 500 ml NS, and always there can be anaphylactic reaction because of that. So always antihistamines, afcolin, and this ADR always should be at hand. And if any such type of reaction, we should give the ADR and afcolin, antihistamines, and wait for a while, and after some time, when it is subsided, then we restart the infusion. So that's all about snake bite management. If you are able to understand whatever I have told, and any such thing that I am not able to cover, please let me know in the comment section. And if you like this video, please give the